So what we've said is there are a number of components of healthcare. One is that for people who already have health insurance, they can keep their health insurance, but we're going to have some consumer protections to regulate how insurers operate. For example, they can't prohibit people from getting health insurance because of a pre-existing condition. They can't have lifetime caps or yearly caps that prevent people from getting the care that they need. We're also going, for people who don't have health insurance, to set up a system similar to what Congress has, where you can buy into a bigger pool, get better rates, have better protections around you. You would be buying that insurance from private insurers, but one of the options we talked about was a public option, where there wouldn't be a profit motive involved, it would be non-for-profit, and that public option would give you affordable health insurance. Now, what we've said is we think that's a good idea, but we haven't said that that's the only aspect of health insurance. And what she essentially said is that all these other insurance reforms are just as important as the public option. The press got a little excited, and some folks on the left got a little excited about this. Our position hasn't changed. We think that the key is cost control, competition, making sure that people have good quality options. If we're able to achieve that, that's the end that we're seeking. And the means, we can have some good arguments about what the best way to achieve it is, but we've got to change because the status quo is unsustainable. I've consistently said I would love the private marketplace to be handling this without any government intervention. The problem is it's not working. What we're seeing is about 14,000 folks lose their health insurance every single day. We are seeing healthcare inflation go up about twice as fast as regular inflation. Businesses are being crippled by it. Small businesses especially have almost no access to the marketplace because they've got no leverage with insurance companies. So all we've said is, let's keep the private system intact, but let's make sure that people who right now can't get health insurance, about 46 million, that they're able to buy into the market. And number two, let's have some consumer protections to make sure that those of us who have health insurance don't end up getting a bad deal because we didn't read the fine print and we think that we have coverage. When we finally get sick and we need it, it turns out that we're vulnerable because insurance companies aren't operating in the interests of their customers.